Hi everyone, my name is Hannah, and today I'm going to be giving a little bit of an introduction to behavior variant frontotemporal dementia, or bvFTD. So what is bvFTD? bvFTD is a specific form of dementia which causes brain atrophy in the frontal and temporal lobes of the brain, as you can see me highlighting here. Brain atrophy is just neuron death, which leads to degeneration and tissue shrinkage in the affected areas of the brain. Degeneration in bvFTD is due to an accumulation of tau or TDP43 proteins. Although these proteins occur naturally, in bvFTD they accumulate so much in a neuron that it can no longer function and eventually the neuron dies. You might be wondering, who is affected by bvFTD? bvFTD has a relatively equal incidence rate between men and women. The average age of onset is between 40 and 60 years old, and although it's not the most common form of dementia, it's the most common form of early onset dementia, which occurs before age 65. In terms of incidence rates, in the United States, approximately 1 in 10,000 people will develop bvFTD. Although the majority of cases are sporadic, 10 to 15% of cases have some genetic link, and up to 50% of patients will have some sort of family history of any type of dementia. So what does bvFTD look like? bvFTD is mainly marked by personality changes, one of which is apathy. When patients are apathetic, they experience a lack of motivation, they'll have a blunt or no emotional affect, and they'll often lose interest in hobbies that they might have previously had. Another key feature is disinhibition. When patients are disinhibited, they'll act compulsive, erratic, or often will act inappropriately in social situations. This is often somewhat embarrassing for their family members. bvFTD patients will also experience difficulties functioning due to frontal and temporal lobe degeneration. They'll often struggle to plan and execute tasks, and due to temporal lobe degeneration, will struggle with language sometimes. Because of disinhibition, they'll often exhibit binge eating or binge drinking, and as their condition further worsens and degenerates, they will require increasing levels of care through disease progression. How is bvFTD diagnosed? bvFTD cannot be definitively diagnosed while patients are living. This is because diagnosis can only be definitively achieved by confirming accumulation of tau or TDP in neurons of affected areas. A probable diagnosis, however, comes from neuropsychological testing, interviews with the patient's family members, or neuroimaging, either an MRI or a PET scan, which shows frontal or temporal lobe atrophy. Diagnosing bvFTD is often challenging as it is often misdiagnosed as various psychiatric illnesses, most commonly depression or bipolar disorder, or as other forms of dementia. It's also challenging not only for physicians, but for family members of patients as well, as patients are really not aware of their symptoms and they will always believe and insist that nothing is wrong. This is difficult as it leads to a lot of back and forth between patients' families, and physicians as they try to figure out what exactly the problem is. So once bvFTD is diagnosed, how is it treated? Unfortunately, there's currently no cure for bvFTD, nor are there any curative treatments to prevent the accumulation of tau or TDP43 proteins. Currently, the only available treatments are designed for symptom management to make patients more comfortable through disease progression. Medications that can be prescribed for bvFTD treatment include SSRIs, antipsychotics, and occasionally drugs for treating Alzheimer's disease are prescribed, however these have mixed effectiveness. These medications are used to manage apathetic behavior and disinhibitive behavior. Lifestyle adjustments can also be made to improve the quality of life of bvFTD patients. These mainly include avoiding triggers for disinhibitive situations, creating schedules for patients to follow, and maintaining cognition. You might be wondering, if a loved one has bvFTD, where could you find support? One of the best associations for bvFTD support is the Association for Frontotemporal Degeneration. They can be found at the afd.org. Support for Nova Scotians specifically can be found through the Nova Scotian branch of the Alzheimer's Society at alzheimer.ca/ns. Most importantly, if you suspect a loved one has bvFTD, you should talk to your physician. Thank you so much for watching this video. I hope you were able to learn a little bit about bvFTD.